Hello everyone. Today we will speak about our main problems regarding our doctors, teachers and the whole population. My presentation today would be to fighting the risks of the stress, cause of the trauma and professional burnout of the doctor's sphere. So in order to talk about the risk, let's remember about what types of stress exist. We have basic stress, which always is present in our life. Everything we do, there is some stimuli and of course some stress for the body to do this action or make this decision. Besides, there is cumulative stress, which a person gets when the person gets more pressure and she doesn't have enough time to relax. After such stress, burnout can come, but of course there is another type, it's traumatic stress. It's very high and you can get other conditions for the person. Please look at this chart, how people have the traumas. You can see the stress level and the productivity performance, which increases or lowers. So first, the lowest, it's like lame, person doesn't have any stress. Then there is much more tension. It's a healthy tension for to do any type of job. You have motivation and you have good stress to do any decision or to make an action. Of course, the focus is on what you are doing and the person starts work productively, do productive actions and rises to the peak of the performance. If a person doesn't have gives yourself time to relax, there is a kind of fatigue. It's like exertion, you're becoming sick, you're having more stress, anxiety, and after that the person has panic, anxiety, anger, and the productivity level is very low. If there is no relax, it leads to burnout and disease. The person doesn't behave the right way, couldn't make the right decisions and fix them quickly. Now we're speaking about the risk. So where can the situation lead? It could be a secondary stress, empathy trauma, empathy disorder, moral trauma, which can lead and which leads to burnout. We, we see these terms that are very close to each one another, but the processes in the body are very different. So there are two directions. First, stress through trauma and professional burnout. Why it's important? Because first we already talked about that the productivity changes depending on how human under which stress exists. Besides such a situation, if the person is very loaded on the with the work, she couldn't notice it as well. It can lead to she doesn't notice that she is coming close to the burnout. There are clinical symptoms: headache, sleeping bad, low appetite, and the KPI lows in its activity. But she doesn't notice, he doesn't notice, and it leads to the chronic stress. This all, you can lose it if you don't have time to relax and rest, and it leads to big traumas that you need to deal with. So there are three main processes with this trauma: the secondary traumatic stress, second empathic trauma, and empathic exhaustion. I want to talk about the stress. It's a very hard stress, the highest level of stress that can lead to PTSD or adaptation. Usually such stresses, when people extrapolate this stress, when she sees the death or lives such a condition that it was close to dying, or just observing what are people saying, what she sees on the TV. So the secondary stress is the situation when it's not non-direct stress, but through someone. About traumatic stress disorders, which I already told, we heard a lot. Mostly it leads to remembering, recalling the actions, unnecessary thoughts, flashbacks. For PTSD, remindings about your trauma, and such people are also avoiding memories, places which reminds them about the trauma, and this is how they start behave. Hyperactivity exists, irritative, without any too much notice for the person. The person is always afraid of something, hard to concentrate, and too much reflex. First, they try to defend and then only try to analyze. So lots of symptoms that influence the communication. The secondary traumatic stress is formed after the person heard, learned, felt the results of the trauma. In example, they saw a warrior with heavy wounds or any other moments that are in hospitals. There is less of clinic here, but at the same time, from time, it produces the same horrors at night, new triggers. People are afraid to go to doctors, to hospitals, because they think that they would have something like that person if it's not something besides the pain and self-destructive behavior. It seems like the person was helping others, but now she's drinking, started drinking and damaging yourself. Also, they're avoiding the good things that they enjoyed to do, and physical symptoms are starting: hard breathing, pains, and pains that have no reason. Here it's important to understand for the medical personnel that you need to normalize this secondary, and how to normalize them, because it's impossible to change what happened in the past, but the person should rethink the situation, accept it, and change into experience and a new technique, and to re-experience it with a necessary result. If you're working in the hospital, you're having and looking these traumatized people every day. It's a trauma that shouldn't harm you, but it's very hard to make it on practice, to change your mental. And on this background, you need to minimize the minimum day-to-day problems, because if person is day-to-day under blackouts, we are coming home, no electricity, we are starting to be nervous. If we were expecting that it is a scheduled blackout, it's more less harmful. And for medical personnel, it's very important to share the emotions between themselves, because sometimes there is uh, some point and where when you cannot empathize and talk, understand the other person, and it's hard to understand. Sometimes there is a blame that you are not empathic to another person. They don't understand their own situation regarding the patients. I will tell later in detail. It is kind of frustration that you are losing professional skills. Of course, we understand that we should be ready to it, but now we couldn't, and other negative reactions. So what's needed for the family doctors? First, it to have retreat, relax. It's important for the hospital to have a staff member to help their staff members, to consultate them in a safety way, because if we do it in their own rooms, it's not safe, because we have our other necessities of work, and it's important for people that are open to share negative emotions. And how to do it is to conduct training for doctors, because for them not to understand that it's frustrated, it's important to work with it. Regarding the moral trauma, there are lots of problems for moral trauma. It can exist when someone takes part in actions and couldn't avoid them or becomes an evidence of them. And now such a situation is very much experienced by the family doctors about the people with disabilities. Lots of people are afraid to go to the war. When a person is afraid of war, and they are looking for different ways, and doctors should give the disabilities level to some of the older people. And it is very hard situation for the doctors, first level doctors, and they suffer from it. So also potential conflicts when you need to decide that some of the benefits for one people over the other, and you need to make a decision. Both are suffering, both need it, and of course it's feel of blame that you are bad, and if it repeats, the person starts slowly to become angry on himself and to form attitude to himself that he is not a complete person. Empathy. Empathy is when you're taking on yourself the situation that's happening on the patient, to understand him right, to give him the support and the right support. So this is a process of cognitive changes due to the cognitive empathy trauma. So we constantly see and try to understand what leads to negative result, and then cognitive changes come, that we start to see different on this world and to assess different things, what was normal before to us. We change the attitude to our security. In example, do we need to give birth to children in such hard times? Or whether the God exists because everything is so bad, our guys are dying. And burnout, which is a separate topic. It's very close to the stresses that we discussed. So what's the difference between these two directions? First, burnout could be a result of the stress, but not always connected to the conflict situations. We could use if we burn out, this is a conflict or a very, very hard situation. Here, it's not necessary that we would have the conflict situation, but we would have pressure that will give the empathic burnout and lead to burnout. So what gives the biggest, if it's a negative emotion for each, if the people has no force to make the right decision, but the person tries to defend himself. Also, cynicism rise, react to colleagues, patients. So now we see how it forms. Also, you are starting to behave inadequate if the patients don't react to your efforts. But the result depends on the result and on the doctor as well. So I want to show you the scheme of the burnout. Doctor, nurse always try to help, and of course tries to work with patients, of course um, to get the result from the patient, how they can work as partners with nurses, with doctors. But sometimes children are trying to be too delicate with patients, and sometimes doctor wants to be a hero and makes him all the decisions himself, and gives all his pressure to the patient, and patient gives the same feedback, and in this case doctor becomes more worried. And one more thing can occur when a doctor sees how the patient reacts to everything and how he is involved in his own healing. Always you need to have the professional distance between you, of course, to get the patient's work on different activities, for him to understand that his healing is in his hands. This is ideal situation. In such situation, there is no risk for burnout. But when the doctor is starting to give more attitude than it needs, it becomes more cynic, have less contacts with patients, reduces contacts with patients, starts not to understand the patient, can blame him, avoid the proper topic, and at that time the patient starts to suffer, and doctor couldn't describe it to him. So there is not enough involvement of the patient in the process. So this is a scheme of the burnout that we couldn't notice, and empathic stress. This is a symptom. This is combined from the secondary traumatic stress and professional burnout. Why it's important for the first level medical workers? Why this topic? Because the medical staff of the first level, they have the widest involvement to help after the stress or during stress. Stress involved with trauma, it's met all day in different forms, but it's not concentrated as in special hospitals. In example, in surgery, you always have work, it's hard stress, but here, people coming just to tell you about their problems, to have a call, how you are, and each time the people talk to their family doctors, my son died or other problems. So doctor takes all these problems on himself, and during that, the doctor should give an answer the way that the patient would have benefit from it. And it happens each day. We're speaking about the war, but the family doctor has much more problems. The house has burned. There is in car accidents. There's a very wide range of problems. We don't notice it, and we come to the doctors, and we see cynic among doctors. So it was another doctor. So you don't see the bright stress, but the cumulative stress, which influences very negative on the person. Also, the emotional resource is exhausted by the constant work necessities. It's very hard to work on the first level as staff because you need to work with special government organizations. You need to know how to work with the secondary level staff because it's hard for patients to get to the secondary level, for there not to have problems to get the help quicker, and all these are questions are dealt with your family doctor. And first the doctor has problems when the patient couldn't have benefit from his help because the patient need to have help from him. And the doctors from the first level, they think that they're not so important as the second level doctors. And the feeling of blame when the patient has problems with health and you can't help him. And when the doctors has no help, no mental help at work with their burnout. So what to do to avoid burnout? First is to get more psychological rest techniques, training of skills, and supervision and group of help. Skills of psychological rest. It's only rest. Recreation is to do the necessary works, and it's important to understand how to solve these problems. It's important to work in a health environment and not to cross the lines that can lead to burnout. And of course, control of the reaction, because the control of the reaction exists still when the person has no hard problems. But when there are hard problems, you need to turn to the professionals for help. And we have lots of negative thoughts right now. If we won't turn on the good thoughts, it will harm us. There was an Austrian scientist that was in during war, and he left lots of knowledge for us. And of course, to rebuild the social connections, because communication is very important. So about the good thoughts, we have lots of good people here in the Ministry of Health, and if we read them a couple of times and apply them to work, this gives you a tool to go to the positive thinking, and also to work with the mental health organization, hospitals. It's the groups of help. First, we need to learn how to think to each other, because to get out of the prison of trauma is led by words. What we do and what we say, it's not so important when we listen to another person speaking. And even a short conversation can give him the understanding that he is not alone and that someone cares about his problems. It's important to be understanding, and people not always have this because we always work on the autocratic way with the patients, and it's important to help your colleague, your patient. If we are speaking about the feeling of guilty that you couldn't help him, it seems that you are blaming yourself about the things that you could have done. But it gives the possibility to speak further on that. No one blaming him, and it gives the ability to speak more. So it's like ventilation of emotions. And if the people had like stress for 2 3 days, and people get ventilated all these emotions, it is a possibility that would be no PTSD or a high-level stress reaction. If we don't know how to react, it's better to say that it's very hard how I would feel in this situation. The phrase "I understand you" is inappropriate here because we cannot understand another guy. We are not in his shoes. So it's very important to say to our colleagues, patients, just to see on themselves from another point of view. It's important because black and white are in our life, and when we face the problem, this dark side and there is a light side, and we can just change the lighting and to lean on that to solve the problem that existed. And to finalize, it's important that this organizational factors of risks was not supported by that. What I mean, the organizational structure of the facility where the people, patients, doctors live, it's inappropriate situation between the staff, also the lack of resources, safety, facility, and confidentiality. So there were no rumors and organizational culture. It's emotionally good communication between of the colleagues, and the leaders should remember that they lead if there is someone to lead. And it's very important the culture, like emotional trauma, secondary stress, burnout as a normal reaction of people that experience trauma that could be among your colleagues, because we all suffer the bombardings, and it leads to different reactions between ourselves. And this, if we have such good organizational culture, it helps to reduce all these consequences between the traumatized staff members. So it's important that our hospitals have such good trained personnel that can help with that, work with that, and the doctors themselves to be self-learned, because they need to help themselves and their patients and their colleagues, uh, defending our word and saving others, yourself. Thank you. Questions? Yes, please. I was just demobilized from the armed forces of Ukraine, so I have experience 2.5 years as a military medic of the first level. And I experienced a lot when I was sending soldiers to hospitals, because now civilian hospitals are also helping with militaries. I experienced that there is a big difference in an attitude to the patients from the staff, military, doctors, medics, and mobilized. So former civilians that were mobilized, and they do the same work on different levels, in different sectors, and how to say, close to the front line, because we know that demobilized, it doesn't matter where they are, where they work as doctors. So professional military cadres that learned and were in army even before the war, as in most cases I saw, there is absence of empathy, as you've mentioned, cynical attitude to patients, disrespect to your mind. Why it is? It's because of the personal burnout, or this is a lack of good education that came from us to us from the Soviet Union. So I can give an answer three in one. First of all, training education of our doctors is an autocratic, and only 10 years ago we started changing the attitudes. Second, absence, we wouldn't say but roughly not enough knowledge for in the mental health, very not sufficient knowledge. Now we're doing match gap, and we are working, and our university is has a pilot project for that. But beside that, beside of the skills of the effective communication with the people with mental health, we have a lack of doctors in this sphere, and this match gap will teach them. And if we speak about the empathy, our doctors are started learning only recently. First, you can know it, but understanding it and using it, it's another thing. It's trainings that needs to be conducted. And even these 45 minutes that we are speaking on the match gap, it's not enough. From January, I am dealing with this and leading match gap. There are results, there are changes, small changes, but to make a big difference, real, you need to have lots of trainings on on a specific specialist. So it's not one. And regarding the communication with the military, they are afraid of them, and there are lots of request letters that they are asking them to do the training how to speak with patients. Now we are speaking about it. We haven't started it yet, but we are planning because doctors need it. They do not know what to tell people. They understand that people experience something horrible, but how to behave, they do not know. So it's a gap. Thank you. Thank you. Lyudmyla Matviyets, how do you think what else we can do on the state level to increase the level of the mental health of the experience of the medical workers? It can be financing of the psychological groups for doctors. To your opinion, what else can be done? First of all, financing and budgeting couldn't fix this. The most important is training, education, hands-on, and this day today has the goal of this for us to be heard and be given support.
Доброго ранку. Я більше як не запитання, а як об'ява.
Not more the question, but like a notice. I'm the head of the Charity Foundation Mission of Ukraine, and since December, with our partners Be an Angel, we are starting the rehabilitation camps for medical works. First camp would be from the 12th to 20th in Berlin. We can have 5 beneficiaries, 5 civil medics that are working close to the front line that hasn't burned out yet. So this is we have the John Wellen doctor working with us, psychological specialist that deals with burnout, and we have 2 camps for 10 people in Carpathians in January and February. I will tell the dates. If you have the access to our audience, we would be very grateful. Or if you can supervise us, help us, it would be amazing. I'm working in this organization here and also in the Association of the Family Doctors and the head of the Association of the Kyiv region. Thank you. I am grateful. Yeah, we can meet and discuss.
Thank you so much. We are starting to run behind, but thank you, Professor. Thank you.